I'm Dr. William Schell. I am a board-certified cardiologist, as well as a board-certified internist. I am the principal author of the paper entitled Sentra PM and Medical Food and Trazodone for the treatment of sleep disorders. Often physicians and patients find that sleep disorders are a common and poorly treated disease state. In this study, we did a double-blind, placebo-controlled, four-armed, randomized trial of 111 subjects that was carried out in 12 independent sites. We compared low-dose Trazodone, Sentra PM, a medical food, which is also characterized as an oral drug, and an amino acid preparation, the joint administration of Trazodone and Sentra PM, and placebo combination alone. The purpose of the study was to examine sleep latency and restorative sleep to see if we could improve in the groups administered the active ingredients, either Sentra PM standing alone, Trazodone standing alone, and the combination of the two agents administered at bedtime. This was compared to two placebos given in the fourth group, also at bedtime. The placebo agents and the active agents were identical in their nature and could not be distinguished. The primary endpoint of the study was sleep latency in addition to parasympathetic autonomic nervous system control as measured by 24-hour electrocardiographic monitoring. The electrocardiographic signal was analyzed using a complex methodology involving fast Fourier transform that converted time domain data to frequency data. The high frequency band of this particular methodology is specific for parasympathetic autonomic nervous system function. The primary endpoints were compared at baseline and day 14. The subjects underwent baseline questionnaires that were both visual analog scales and Likert scales, as well as the 24-hour ECG recordings. The ECG recordings were analyzed in the frequency domain, which was a continuous variable. This is a primary measurement of what is called heart rate variability, and we used heart rate variability to specifically measure parasympathetic autonomic nervous system function. In this study, the results showed a decrease in sleep latency in Sentra PM and the combination of Sentra PM with Trazodone. Placebo had no effect, and Trazodone alone had no effect. In addition, there was an improvement in the quality of sleep for the medical food amino acid formulation and the combination of the amino acid formulation with the active Trazodone. It should be pointed out that the dose of Trazodone was 50 milligrams at bedtime, which is a dose that was chosen because it is not an effective sleep aid or an effective antidepressant. In the analysis of the heart rate variability, there was an improvement in parasympathetic autonomic nervous system function induced by both Sentra PM and the combination of Sentra PM with Trazodone. In patients with sleep disorders, there is frequently a suppression of parasympathetic autonomic nervous system at bedtime that lasts through the early morning hours. In this particular study, we were able to show an objective improvement in parasympathetic autonomic nervous system induced by both neurotransmitter-based medical food as well as the combination of the neurotransmitter-based medical food with Trazodone. This study indicates that Sentra PM can improve the quality of sleep. The response to Trazodone was improved. There was an objective improvement in parasympathetic autonomic nervous system function, as well as the perception of improved sleep quality without an increase in grogginess often associated with sleep aids.